People with anxiety, unfortunately, miss out on so many things because of the fact that they just cannot be in certain spaces. Um, we cancel things. We stop talking to people. We just live in our own world, and not every place is designed for someone that has anxiety. Um, some of us find ourselves living in environments that are just too chaotic, too busy, and we find ourselves, being that one person that's just not understood, you know, and for someone who's not really aware of that, they would ask themselves like, why is such and such, or why is this happening? Not not realizing that it's actually something that comes from um how can I say this? So yeah, obviously you're gonna feel like you're an outcast um for the most part. You know, people that live with anxiety often avoid a lot of places. They avoid a lot of people. They think differently. They think before whatever it is that they're gonna like. They Let's okay. Let me make an example. Let's say you have to go somewhere, or you have to be somewhere at a certain time. And for example, let's say you're going somewhere the following day. As soon as you know that you're going somewhere, the first thing you're going to do is analyze the environment that you're going to be in before you even get there. You come up with different scenarios. You come up with what could go wrong, how you're going to handle that, you know and bear in mind, like, nothing has happened yet, but you've already created the whole scenario of what could happen. um and it's obviously like the worst case scenario. So you're thinking of, okay, so I need to have my phone somewhere so that it cannot get stolen. I need to approach people and to smile. If I don't smile, people are gonna think I'm rude. Do I have to do this? Do I have to do that? And by the time you get there, your mind is just full of anxiety. You're now anticipating the things that you've been thinking about. You're thinking of, okay, so if he says this, it mean, like, it's a lot. It's a lot. And of course, like, anxiety comes in different, because it's like a spectrum. So there's normal anxiety that everyone has, you know and then there's like chronic anxiety that I have. you know Sometimes it becomes normal, and sometimes it's like hectic. I feel like I mentioned, like meditating and having to calm yourself and train your brain to actually keep calm, because before I was a mess. Like, you could tell that I have anxiety. Right now, I don't think, like, for me, I'm comfortable enough to go into spaces, even though I still have crazy anxiety, but I'm comfortable enough to go to um area, like, I'm like busy places. I don't shy away from those places. I just go and I set my mind on what I'm gonna do. If I stay too long at a place, obviously, I become a little bit, uneasy. But yeah, it's crazy. It's crazy. It's crazy, and it's something that's I've managed to, like, live around. Like, I've managed to, like, I've actually spotted things that actually trigger my anxiety, which is staying in a place for longer than expected. Sometimes it comes to what you say. So sometimes you might say something that you didn't really mean to say, and then you're gonna beat yourself up the whole time because you're like, oh, I should have said something else. Oh, I should have said it in this way. I should have done that. I should have, there's a lot of I should haves that go on in someone that has anxiety. I feel like everyone deals with that, or it happens to everyone. But when you have anxiety, it's like it's it's doubled, tripled. It's more. Um, what else? I feel like I also think that people that are that have anxiety have different coping mechanisms. Some are not healthy, you know. some Sometimes I personally would prefer, let's say I'm going out, okay. That's like way back, not way back, but like maybe a year ago. When I have to like go out with a friend of mine, going like out, I would literally get drunk, not drunk, like I'd get tipsy. I think it was like 2 years ago, if I'm not mistaken. I would prefer getting tipsy so that I'm a bit loose, you know, I'm not stiff, you know, because I feel like when I was tipsy, I w- I would actually not give a fuck. Like I wouldn't care who's doing what way, who's watching me. I wouldn't care. I would just go there, enjoy it, and then be in the moment. Um, that would help me a lot. Um, what else? Yeah, like there are certain coping mechanisms that we end up having to um acquire, if that's the right term to use, just so that we can actually cope, you know, which is not good. I've obviously taken it upon myself to see a medical doctor, to go to therapy, because there's a lot of other underlying issues that I personally deal with. And to be honest, okay, let's be honest about therapy, okay? Therapy, I'm not sure about therapy, because I feel like it's something that you have to keep doing. I don't know. Like, I don't understand the concept of therapy. Actually, I just realized that now. So you have to go to therapy, talk to this person, tell them everything about yourself, um, and then they're gonna come up with a solution. And that solution doesn't even, by next week you probably need to go again, because it's like it's not something that's like it's something that they can. It's like they install something in you, and then it expires, and then you have to keep going back, and then So I feel like, as much as therapy worked for me for like a short while, and it also works for other people that actually go to therapy consistently, I feel like doing your own self work, find ways to like do self work by yourself, and actually manage your own health, mental health. I feel like that's better. But if you feel like you're not strong enough to actually go deep and like see what's making you feel a certain way, I would recommend therapy. But for me, but I don't think it's everything. Therapy is not everything. It's just, because when you go home, you're alone. You don't have anyone to talk to, and you can't be in the therapist's office every other day. You still have your own life that you have to deal with. So it makes sense when you sit down with yourself, meditate, do all these things that you have to do. Um, like find ways to deal with what you have, you know, on your own, and then maybe therapy can like um, help you. I don't know, like be like an extra push or an extra, um, yeah, yeah. So again, like we're not all the same. Like people are different, we handle things differently. So to you it might be of good help, to others it might not be. So I hope my explanation of anxiety actually did come across. Yeah, that's basically how anxiety feels like. It's not a if you don't take care of your anxiety, it's definitely gonna ruin your life. I'm not gonna lie, it can make things very difficult. And try and surround yourself with people that understand, and understand that if you are misunderstood, it's not because you did something wrong. It's mainly about the people around you that are not informed, or maybe they just don't know what's going on. And you don't have to be explaining to everyone, hey, I'm not trying to, like people won't understand, but be okay with that. Be okay with that. There's a lot of people out there that are gonna be understanding, that are just gonna get you. And then yeah. So if you don't feel like doing something, don't do it just because you want to be accepted. You know, deal with whatever you're dealing with, and then yeah, be comfortable and just understand yourself, learn more about yourself. Actually, that's a right way to do it. But yeah, that is it. That is my 2 cents for today. I hope everything made sense because I have a tendency of mumbling, but I'm still, however, going to post this video because I want to get used to talking to the camera. I think this is my fifth video, if I'm not mistaken. Yeah, so yeah, if you want to join me in this journey, you are a lot. You are welcome to subscribe and leave a comment. Let's engage. Let's talk. Yeah, let's talk. Thank you so much for tuning in. I will see you guys again on the next video.